another record mid-year report in digital health, more than $6 billion raised in the first 2 quarters of 2018, 414 deals. That's the largest mid-year deal count to date, and 60 deals more than we reported last year at this time. This increase in deal count is partially due to the rise in new international hubs of health innovation, particularly across China, which dominates the global market with over $500 million invested. As the market expands globally, we're seeing every section of the market receiving funding, from insurance to biometric data acquisition. Okay, so they release this report. They do it every, I think every 6 months they actually release a report. I could be wrong. Maybe they do it quarterly. And so they have some interesting charts on here. So in 2010, there was a 1.2 billion in funded deals. Halfway through this year, we're at 6.1 billion and 400 some odd. Does the appetite to fund digital health startups surprise you at all? And do you think it's going to continue at this pace?
I don't think it's going to continue at this pace, but I'm always a little bit of a pessimist. I will say that I've been very happy to see this increase in funding, because when we started, I talked to some prominent VCs in Seattle who said, I don't think anyone's funding digital health. And I was like, I'm seeing something different, but it's great to see both Rock Health and Startup Health coming out with these reports. But I do think you have to look deeply at what's being counted. I think if you remember last year, one of the biggest deals was Outcome Health. And yes, they were digital health, but they were really pharma advertising. And then turns out that, maybe they weren't even doing that right. But if you look at the Startup Health, like Point Click Care is an EMR that focuses on skilled nursing and long-term care facilities. So is that digital health? I guess so, but that's not a new company. So if you look at the 10 largest deals, you kind of have to say, okay, which ones are really falling into this category and which aren't? And I would say, Point Click Care may not fall into that category. Oscar certainly does, but they are a payer. So it's just something to think about, of like what is making up this category. I think China is interesting, and certainly, we're seeing two things. I think I was looking this up. I think it was Baidu who just dropped their digital health team. So there's like a whole bunch of weird things happening. Lots of funding, and then Qualcomm is getting rid of their digital health. GE's getting rid of their digital health. So I don't know. There's a lot of flux going on, and that's why I sort of feel like that could be the beginning of maybe we're looking more at outcomes and revenue than funding as a metric.